Slijepcevic from Belgrade. Extent and complications of thyroid surgery now and then.
Good afternoon to you all, and thank you to the hosts for inviting me to Zagreb again. I think it's my third time here. And today I'll try and tell you something about our experience, a study we conducted about the extent and complications of thyroid surgery, now and then a single center experience. My voice is not as good as it used to be because I sound like somebody who just had a thyroid operation complication, but I have a cold since this morning, so I'm sorry. Anyway, when we talk about thyroid complication, we have to first think about that in the 1860s, when they talked about complications, it was a question of whether the patient would survive or not a thyroidectomy. Nowadays, even in the beginning of the 20th century, William Halsted referred to this operation as a feat that could be accomplished by any competent operator without an adverse effect. Now, going towards nowadays, nearly a century later, complications, of course, still occur. However, in the hands of experienced endocrine surgeons, thyroid surgery can be performed with low morbidity and extremely rare mortality. Today, though, when we talk about surgical complications, we mainly talk about bleeding, injury to the recurrent laryngeal nerve, and hyperparathyroidism. For this reason, it is considered by many surgery of the recurrent laryngeal nerve and the parathyroid glands. I will try and be as short as possible since it's already near the end of the session, and I'll go down to the results of our study that we conducted. The aim of our study was to determine the incidence of surgical complications and the extent of thyroid surgery that we performed for patients operated in two separate periods, more than a decade apart, and to determine whether there were any statistically significant differences between the extent of surgery and the incidence of surgical complications into these two separate periods. The study included 4,500 patients who operated on in 2-3 year periods, as I mentioned, more than a decade apart. Due to inconsistent data for the first period, we could not analyze permanent hyperparathyroidism. So for statistics we used descriptive statistic, two-tailed Yates corrected chi-square test, and Fisher's exact test. So we analyzed the extent of surgical operation, and we marked it like this, as TNT plus, meaning total thyroidectomy, near total thyroidectomy, or greater than that. And less than TNT plus, meaning any other operation that didn't include those. And of course, we analyzed postoperative bleeding, symptomatic hyperparathyroidism, which we defined as not only by the values of the clinical values of the calcium and PTH levels after the operation, but as well on the clinical signs if patients develop certain Koschek signs, which Professor talked about earlier on, which we'll not repeat now. And postoperative dysphonia was marked as a change in the voice of the patient after the operation, which was evaluated 1 month after that on the control, when the patient came by an ENT exam. And if we found recurrent laryngeal nerve paralysis, it was then marked as a definite paralysis of the recurrent nerve. So these are our results. The table is a bit maybe big, but I'll try to focus on the important things. These are the periods, period 1 and period 2. As you can see, in the first period, we operated only 20% of the patients had thyroid cancer, while in the second period, it was nearly 30% of the patients having thyroid cancer. So you can see there's an increase of the patients who had thyroid cancer. When we come to the level of extent of surgery that we performed, in the first period, only 40% of the patients, looking at all the patients, had a thyroid total or near total thyroidectomy or plus neck dissection. While in the second period, it was more than 80% of the patients had a TNT plus extent of surgery. Now, when it comes to the complication rates, in the first period, it was a bit less, lower than 0.5% for these patients, while in the second period, it was more than twice greater. Looking at transition to symptomatic hyperparathyroidism, the rates did not differ much. They were around 2%. And When we looked at transition recurrent laryngeal nerve paresis, the rates were high in the second period, as was for permanent recurrent laryngeal nerve paralysis. Now, this doesn't sound too great, but when we looked at this statistically, and we saw that for patients with thyroid cancer, we found that the percent of patients operated for thyroid cancer and who had a TNT plus operation was highly statistically significant in the second period. The other rates did not prove to be at all statistically significant. When we examined all the patients, so patients operated for cancer and for benign diseases of the thyroid gland, we found that as well in the second period, as we noticed before, twofold increase of the percent of patients who had a operation of total thyroidectomy or near total thyroidectomy, while the complication rates for bleeding showed statistical significance, as did the complication rates for dysphonia, as we marked it there. That is, let's say, transitioned damage to the recurrent laryngeal nerve. On control, we did not find an increase of that. Now, we wanted to evaluate the results of our study with the results of some other authors. And when we look at the complication rates for various studies, this was our study that was the beginning in 1999, and the other study that finished in 2012. So these are the two periods we were examining. So when we go look from 1998 to 2012, we see that the range of bleeding, post-operative bleeding, range reported as 0 by a Turkish author, and ranged to 2.1. Our study proved in the second period to be nearly 1%, so it's, let's say, somewhere in the mid-range of those reported complication rates. When we looked at transition hypoparathyroidism, you see that the rates vary a lot, and the problem from 127 to 28.4% of patients, that is more than a quarter of the patients having a problem post-operative with the parathyroids. So the reason for this, we can discuss about that afterwards, but most of the reason is the way of collecting data and entering the data and defining actually what is transition hypoparathyroidism. So that's the main reason that these values are so different. When it comes to temporary damage to the recurrent nerve, transition that is, it ranged from 0.7 to 3.9. In our study it was 2.3. And when it comes to permanent damage unilateral to recurrent laryngeal nerve, it ranges from 0.2 to 1.3. In our study it was somewhere halfway. So what can we conclude out of all of this is that each institution that practices thyroid surgery should audit their own complication rates, since they vary a lot. So we cannot quote various studies saying that the complication rates for thyroid surgery is such and such, if in that hospital, for instance, you do not know what are your complications rates, and they could be maybe even higher or they could be lower. So we strongly feel that every institution should audit their own complication rates. What we can conclude that in our center in the second period, which is 10 years later, we had 10% more thyroid cancer patients, and we did 20% more extensive operations for thyroid cancer. And thyroid cancer surgery did not have a higher complication rate, where we would maybe expect there a higher complication rate because we are trying to be a bit more aggressive when it comes to cancer than when it comes to benign diseases. Generally, that should be a general line of rule. But we did find, actually, on the contrary, higher complication rates for bleeding and transition recurrent laryngeal nerve damage in the second period when we examined all the cases, meaning benign disease patients. So this should alarm us and tell us and ask ourselves that we should further investigate these findings and ask ourselves, are we being too aggressive with benign diseases? Thank you for your attention.
Thank you, Dr. Slijepcevic. Question, please.